Okay, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Aminola Dada, and I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. We have a treat today. So we have the amazing Dr. Megan Melo, who is in the Seattle area. So I have somebody local. I'm excited. And Dr. Megan Melo is actually a very good friend of mine. Plus, she's an amazing board certified family practice doc, plus obesity medicine specialist. So I'm going to let Dr. Megan Melo introduce herself because we have a lot to talk about.
Yes, hi. It's so great to be here. I'm so glad that we're doing this today. But I'm Dr. Megan Melo, and I am born and raised in the Seattle area. I'm one of the few people who've been here my whole life, and I'm board certified in family and obesity medicine and practice both at Phinney Primary Care and Wellness in beautiful Seattle, Washington. And we're enjoying a nice sunny day today, even though it's March and we've had a lot of drizzly rain. I'm also certified as a life coach and a Daring Way facilitator, and I really do some work on the side, coaching physicians on areas around burnout, people-pleasing, perfectionism. And, of course, some of that gets woven into my obesity work because a lot of us struggle with those issues in our sort of own self-care, health, and wellness as well. So that's a little bit about me, and I'm so excited to be here.
I'm excited. I'm so excited to have you. And so we are going to actually delve right into the burning question that everybody has, the hot drugs, right? So these GLP-1 medications for weight loss. So let's talk about it. And, I'm going to ask some questions too that's kind of in my world of inflammation and how that's
Absolutely.
making a difference. So let me, my first question, how does this drug actually work? Like, how does it help weight loss?
Yeah, great question.
Does it stimulate the metabolism? Does it make you eat less? Does it do a combo? What's the deal?
Yes, and yes. So I'll introduce the medicines just a little bit, and I'm gonna use brand names because that's what people
Yes,
know.
please.
So
Thank you.
everybody has heard the word Ozempic.
Yes.
Ozempic is a brand name for the diabetes version of a medicine called semaglutide. When Novo Nordisk came out with this, they decided they would have a diabetes product they would call Ozempic, and later they came out with a weight loss product, which they call Wegovy. They're both the same medicine, but there are very real differences in how these medicines are covered. But everybody has been hearing about Ozempic. There's another product that's out there on the market called Mounjaro for diabetes, and that molecule is called tirzepatide. And then we've got Zepbound, which was recently approved for weight loss. So again, we've got a diabetes flavor of the medicine and a weight loss flavor. They are the same drug. So we've got semaglutide, the medication, and tirzepatide, but under their brand names. These medicines are truly pretty remarkable. The main way it's thought that they work is they act on gut hormones and they help to slow down intestinal transit. So what that means is that people have less hunger in between meals, they feel full faster, and they eat less. I've had some patients go on these medications and they say, I didn't really know what people meant when they said they were full because I've never felt that. They feel hungry all the time. Now, that's not everybody's story, but these medicines are very good at helping people to stop eating sooner during their meal and to keep them satisfied longer in between meals. So that's mechanism number one.
Okay.
Mechanism number two, which is why they work for diabetes, is they're helping with insulin and blood sugar metabolism. So they are reducing super high levels of insulin, and that helps to regulate blood sugar. So they are not a kind of medicine that will really drop your blood sugar too low typically, although that is always the warning on the package. It might drop your blood sugars too low. But the third mechanism I think is the most interesting.
Yeah.
And that is that it can really decrease cravings and really turn off some of the reward circuitry in our brains. So people will tell you they're less interested in junk food. They are less interested in sweets and salty snacks. They don't have food cravings. They're not thinking about food. They're less interested in alcohol, marijuana, probably tobacco. And very, very interesting, gambling. There was a study that came out that showed there's a decreased interest in gambling when people are taking these. And so you can see it really is working on probably the dopamine pathway in the brain, and really just taking away the reward light up benefit that some people are really overly sensitive to with food. And so people feel really, really different when these medicines are working well.
Wow, that is, I had no clue about that.
Yeah.
That is pretty darn cool. Okay.
I would say that for some people, that's the most significant benefit because there's so much emotional eating going on.
Yeah.
And emotional eating is just defined eating for reasons other than hunger. So the birthday cake that you eat, even when you've had a full dinner, right? The snacks you do because it's TV time, right? All of those times that you eat when you're not hungry is called emotional eating, and it really decreases that dramatically.
Wow. Okay. Does it change your metabolism at all?
Because it's working on the blood sugar and insulin regulation, it does improve your metabolism. Yeah. And so that's a part of our metabolic pathways that isn't strictly calories in, calories out. It's how our bodies are processing the foods that we're eating. And so we will see improvements in metabolism when people are using these medications.
Okay. So, what are the lifestyle? Because, one still feels that, if only it was going to be that easy, right?
Right.
Get a shot and keep it moving, right? And just keep doing whatever you were doing. But it sounds like there probably should be, or would be, are there recommendations on lifestyle changes that one should do in addition to taking those medications?
Absolutely. And I'll say that not everybody follows through with the lifestyle stuff, and not everybody is appropriately counseled. But because we are decreasing the amount of food that we're eating, we really want to increase our protein and our fruits and vegetables on our plate. So it's easier to do that when you're kind of less rewarded, in your brain by, having, really highly, snacky foods and really salty, sweet things. But we want to make sure that we're getting adequate protein, which is going to help us maintain muscle strength. And we want the nutrients and the fiber from our fruits and vegetables. And so that's really important. So I talk a lot with people about plants and protein being on their plates. Additionally, we want to really start people with some strength training. And that, that could be, the person who is doing a lot of cardio exercise, but not any strength. I want to add in some strength training to really build and maintain muscle. It could be someone who's not exercising really at all. I want to really slowly get them on a path so they're not hurting themselves, right? But starting to really build muscle strength. Whenever we lose weight, we're at risk for losing protein, bone, fat. We want to really maximize fat tissue loss, minimize bone and muscle loss.
Yeah, that's funny. You could have been a fly on the wall. I was having an appointment with a patient yesterday who was on, I think, Wegovy, and she has probably lost about 20 pounds. And so I asked her about the exercise program, and from my standpoint, it's really more your bone density. Right? Because that's my world. And I was like, well, you keep losing this weight, we're going to need to build some muscle mass. Talk less of just, having skin that's like not attached to any muscle, right? And just having, and I was like, you're going to have to do surgery. But I was like, it's not, for me, it's not just the aesthetics, it's your bone density. How are we going to keep that up? And so you're kind of mentioning the protein and the strengthening exercises, I think is really critical. So, okay, good. Thank you for, without me really actually fully understanding, I was just like, bone density, we can't lose it, right? We're going to have to.
Right. We want to minimize that. And so, for the bone density component, maybe I need to start adding that in of talking more about that, right? So I get bonus points with you, but, we want to have some impact exercise there as well.
Exactly.
And so making a combination of activities, but that can be walking. Right? Like it doesn't have to be, I'm going to start training for a marathon. When we look at big studies of people who've maintained significant weight loss, most of those patients are walking. They're walking regularly, usually at least 150 minutes over the course of a week, which is, 5 30-minute walks.
Yeah.
You know, it's so good for
Like,
our physical health, our mental health. So yeah, you're always going to hear me preaching about that.
yeah. Well, yeah. Okay, good, good. Yeah, because that's okay. What about dietary restrictions?
Great
Are there any
question.
dietary restrictions or specific eating patterns that's kind of recommended when patients are on this?
Not really.
Okay.
You know, like I said, I think it's really important that we're getting protein in plants.
Yeah.
And, you know, the other reason to really emphasize that is that because people are full earlier in the meal, if you're starting your meal with protein and plants, you know, then if there's something else on your plate, right? If there's, I don't know, say bread, pasta, mashed potatoes, things like that, you're going to have less room for that. And you're
Yeah.
probably going to stop eating them.
Yeah.
Those foods are not terribly nutritionally
Yeah.
great. Like they're
Yeah.
not necessarily the worst foods for you, but
Yeah.
you know, if we're focusing on the nutrient rich protein in
Yeah.
plants,
Yeah.
then we're naturally going to leave off the less you know, less sort of nutritionally beneficial foods. There aren't any real strict restrictions, but I do encourage a mix of both animal and plant protein. There are some studies that suggest we do better with muscle mass building when we're having animal protein if you choose to eat meat. And with more plant-based protein, that we will lose more of the visceral fat, which is kind of the fat around our bellies,
Yeah.
that is kind of coating our organs and metabolically, you know, kind of contributing to inflammation and blood sugar issues.
Yeah. Interesting. So you're saying plant-based proteins are able to help with kind of reducing visceral fat,
Correct,
right?
correct. So
Versus
thinking,
animal-based proteins.
right. So, you know, plant-based proteins would include things like tofu,
Mm.
nuts, beans, you know, things that have more protein in them, and even your more protein-rich grains like
Mm.
farro, spelt, quinoa, things like that.
Okay. Yeah, I'm cutting down on my meat intake. But you know what? I was with my friend the other day, and her husband went vegetarian, and she looked at him and she's like, "They're still overweight vegetarians."
Oh, absolutely. Vegetarian, vegan does not imply a healthy diet.
Okay.
You can be vegetarian and eat very few vegetables. You can be vegan and you can eat Twinkies and Oreos. So,
Okay.
you know, when I have somebody, you know, who says, "Oh, I'm vegetarian, oh, I'm vegan," I'm like, "What are you actually eating? Are you eating fruits and
Okay.
vegetables every day? You know,
Mhm.
are you eating, you know, good sources of protein?" Because sometimes
Yeah.
people are having a pretty carbohydrate rich
Yeah.
diet. Either they're having a
Yeah.
lot of bread, pasta, you know, a lot of starchy vegetables like
Yeah.
potatoes.
Yeah.
And they're not including a lot of the more nutrient rich,
And
you
more
know, fruits
nutrients.
and veggies.
Okay. 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 So yeah. So I think a lot of times people feel like, well, I'm already a vegetarian. What else do you want from me? Right?
Yeah,
So I'm already giving up meat. What else do you want?
right.
Well,
But you know,
apparently a lot
like,
more.
yeah, tater tots and you know, yeah.
I
So
don't
it
know
really
if it
matters.
comes from a yeah,
What
if
are
it
you
comes from a
eating?
package, it's
Yeah,
probably
yeah.
not great.
Yeah, you know, I like people to, another, you know, sort of principle I teach is, you know, eating real food, you know,
Yeah.
so not a lot of, you know, shakes and bars and, you know, kind of produced products. And I kind of give this guideline that I heard years ago that I love, which is if your great grandmother would look at your plate and she would recognize it as food,
Yeah.
it's probably a good choice, right?
Yeah.
She may not know, like, you know, an apple versus a pear if she'd never seen them before, but she could probably identify it as a fruit as opposed to a Dorito,
Yeah.
right? Or a Cheeto,
You're like,
right?
what is that?
What is this? I don't know what this is.
I've never seen this before. Is that food? Uh, question. Um, I've seen a lot of patients who, they were on Wegovy and insurance didn't want to pay for it
Yeah.
anymore. It
Yeah.
became very expensive,
Yeah. Let me
and
tell
they
you about,
stopped the medicine,
yeah.
and there's this rebound. So I don't know if it's rebound
It's
weight
not
gain.
rebound.
What is
No.
it?
Yeah. So I'll tell you kind of what happened in the last couple of years. A lot of people were put on Ozempic who did not
Yeah.
have diabetes, but did have a
Yes.
weight problem.
Yeah.
And for a while, they got away with it. There's nothing illegal about using medications off label, but when insurance discovered that patients didn't have diabetes,
Yeah.
they pulled them off those medications. The same
Yeah.
thing happened last year with Mounjaro. for a while, patients were able to get it for weight loss, and then they took it away. And so a lot of people are in that camp. Because of normal physiology in our bodies, our body wants to defend a higher body weight. And so if somebody, you know, let's just say for easy math, if somebody always weighed 180 pounds and they need 1,800 calories to keep at that weight their whole life, that's going to be very different from the person who was 180 and then gained to 230 and then lost weight back to 180. That person probably needs 1,700 calories. If they gain weight and lose it again, they probably need 1,600 calories. So their metabolic rate drops the more times they've gone up and down.
Wow.
And so whatever we do to lose the weight, we have to keep doing. So that's true of these medications. It's true of the eating changes that come along with bariatric surgery. It's true of our other anti-obesity medications. It's true of, you know, nutrition changes like keto. How many times have you heard someone going on keto? They do it for 6 months to a year. They do great. They lose weight. And then they decide, I can't do this anymore. I'm good now. I should be fine. They go back to non-keto diet and their weight comes back up. This is our physiology. This is the way that our bodies are wired, because our bodies want to protect us from famine. Now, most of us are never going to experience anything remarkably close to a famine, right? We might cry if we're without food for a few hours, right? But most of us are surrounded by too much food all the time. And so it's not rebound. And that's kind of what the popular press would have you believe, that it's Ozempic's fault that I regained this weight. It's not at all. It's your body. Your body no longer has the help that it had to lose the weight. Your metabolism is different when you've gained and lost weight. And therefore, it's harder to maintain a weight loss than it is if you never gained the weight, right? There's a consequence of, you know, kind of yo-yo, you know, up and down weight loss, weight gain. And that's why these medicines are considered long-term. Any medications we're using for weight loss really need to be long-term, but that's very different from what we've always heard, right? We've had diet drugs that would be short-term things. We've had crash diets, right? We've had all kinds of things that are about short-term.
So is there anything that one can do? So, you know, I mean, in my world, you know, I put people on medications for the immune system and that kind of thing. And number one question they'll ask me is, when can I get off this thing? Right? So then the question is, when and how? So does kind of the lifestyle changes that you talked about, does that help at all to allow, and maybe that's motivating, right? Do those lifestyle changes that we talked about, you know, the more protein, the more veggies and strength training and walking, do those kind of help you to maybe be more successful with life without Wegovy or life without the GLP-1? What do you think?
Great question. You know, yes, certainly those choices are always going to be important, but in nearly all of the studies, most people will regain the weight because we're taking away the support, and their hunger may increase, you know, so it makes it harder to stick with the lower calorie requirement. You know, their food thoughts and chatter and cravings may come back, right, when they're no longer having that. So it's not true that nobody can maintain a weight loss, you know, after they've made these changes, but consistently in studies, we see that the majority of people are regaining their weight. And, you know, so it really advocates for long-term use of these medications. What we don't know yet is that if somebody loses weight, let's say with Wegovy, and they've been successful for several years and they're doing well, can they switch to something else? Could they switch to some other kind of anti-obesity medicine that helps to regulate hunger, for example? You know, of course, our companies that are making these drugs are not really very inclined to do those kinds of studies because they don't benefit from it. You know, we get that, right? That's, you know, that's kind of part of the business of, you know, the pharmaceutical industry. We will have practical experience of this over time because, of course, we have people who lose coverage for these medications.
Yeah,
And
so
then
true.
they have to go off, or, of course, some people want to try and see what happens if they
Yeah,
do go off.
yeah,
But most likely they're going to need some kind of additional support.
okay, yeah. Would that would that would that matter with how much weight is lost, right? There's some people, right? I'm going to put my brother on blast here. He's like, hey, I need to lose 10 pounds. Prescribe that drug for me. And I was like, no, I'm not going to be prescribing any drug for you, because if anything happens to you, your mother is coming for me. So I'm like, no, I'm not going to be me. But, so he's like, but all my friends are losing weight and then they're showing off.
Yeah.
So what happens to the 10-pounder, the one that's kind of struggling with the last, and I'm sure the insurance company is not going to love that idea, right?
Right. Right. I mean,
What happens
insurance
to those
is
people?
not going to pay if you've got 10 pounds to lose.
Not
I
the
know that
vanity
people are
pounds.
doing this. I've been hearing about it, oh, spring break is coming. Oh, summer's coming. I want to lose. Like, I get it. I'm a human. I live in the world. You're probably going to gain it back when you stop. Right. I can't really speak to people's experience with that, because that's not the way that I prescribe them. I know it's happening. We've got a lot of compounding pharmacies, a lot of medi spas and sort of pop-up clinics that have opened who are pushing these compounded medications. That's not what I'm doing. I know it exists. I'm really focusing on the people who are medically appropriate for these medications, who are understanding this is about long-term health. And what we haven't talked about yet is, and you can speak to kind of the joint inflammation, but what we see with these,
you're way ahead of your time,
we'll get there.
but that's coming up.
But let me talk about, what else we're seeing in terms of additional benefits of these medicines. Is we're seeing reversal of fatty liver disease. We're seeing improved cardiovascular, heart health outcomes. So just last week, Wegovy got a secondary FDA approval for use for secondary heart prevention. So people who have had a heart attack or had, coronary artery disease, so maybe they've gotten a stent or something like that, and have a weight issue, now they're going to be able to get better coverage for these medications, even if they don't have diabetes. Because we're seeing improved outcomes. People are living better, healthier, longer with these medications. So I think there's a lot of potential benefits from them. And like I said, you're going to talk about, kind of the joint health, sort of things, but, it's part of the promise of these medications. But let's talk at the end about, kind of the insurance issues that come up around it. But I'd love to hear your take on the joint stuff.
Yeah, so actually an article came out, I think about a month or so ago, and they were really looking at the effect of this GLP-1 on inflammation. I think we kind of already know that adipose tissue, which is fatty tissue, is pro-inflammatory, right? And we do know, I have a lot of consults over the years where patients were referred because one of the markers for inflammation, called it the CRP, C as in cat, R as in rabbit, P as in Paul, were elevated. And they couldn't find out why. And the patient feels great. And so sometimes we do an ultrasound of the liver and we find there's inflammation in the liver. And the CRP is actually produced by the liver, right? So sometimes we say, okay, go see a nutritionist and let's see what we can do to reduce maybe some weight that may be irritating the liver. So having this GLP-1 medication is really revolutionizing, I think. And we're just at the beginning.
We are just starting with these medicines in terms of indications other than diabetes. They have been available for diabetes for a number of years now. But these particular new ones are uniquely much more effective for weight loss compared to some of the other GLP-1s that we had, and we're seeing these benefits.
So I think we're excited in our world to see something else that may even be treating kind of, even because a lot of times when those people have elevated inflammation markers, I say, oh, it's coming in from your liver. And the last woman said, well, what's wrong with my liver? I said, well, you have a fatty liver. So you're saying I'm fat. And I said, well, we didn't say all that. All I'm saying is that inflammation, and because there is also the cardiac CRP, right? And it's really hard to know how much of, how much of that is actually, increasing the risk of cardiac events, right?
Right.
Because we do know that people with rheumatoid arthritis have a higher incidence of cardiovascular disease. So it's going to be really interesting to see kind of the benefits long term in a lot of the conditions that I treat, especially when the patient also has obesity.
Right. So let's talk
on that at all?
Yeah, can I talk a little bit about the insurance challenges? Yeah, because that's on everybody's mind as well.
That is what can they pay for, will they pay for it?
Yeah. So when Congress sits down and they put together the list of what needs to be covered by health insurance, they left obesity off the list. So they have to cover conditions like rheumatoid arthritis, cancer, prenatal care, well child visits, diabetes care. They have to cover those things. Commercial insurance plans have to cover them. State Medicaid has to cover those things. Medicare has to cover all of the insurance plans have to cover those things. Obesity is off the list. Fertility treatments also off the list, right? So that's why people don't have coverage usually for fertility treatments. Now, when employers are shopping around for insurance plans to offer their employees, they have the option to add in coverage for fertility or for these obesity treatments. That's why some people have coverage for bariatric surgery and some people don't. But that's true of these medications as well. So we have some employers who are choosing to pay for these medications for their patient or for their employees, and some who don't. And so one of my questions for people when they are coming to see me is, who do you work for? Because that's going to give me a sense of how likely is it that they might have coverage, because I have a secret list of, employers who are seeming to be covering. Now, of course, they can change that at any time. But, we're also seeing a lot of pressure coming from, people who work for companies and really pushing their employers to start paying for it. We've got advocacy groups that are trying to move the needle in Congress and say, you need to start treating obesity like a real disease, which it is, right? It is inflammatory, metabolic. Now, not all people with obesity have metabolic dysfunction, but a lot of people do. And if they don't have metabolic dysfunction, they still have a lot of pressure and, stress on their joints, right? They have more sleep apnea. They have all kinds of things that, can lead to more serious problems. Yeah, of course, arthritis.
So can you tell us a story of a patient that has had a really good and amazing outcome that you want to share with us? And sometimes we can see ourselves in stories.
Yeah. I have so many patients who, get started with these medications and they're really so happy that they finally, have a way to really regulate their eating, and they're finally seeing their efforts pay off. A lot of the patients who come in to see me have struggled with obesity for a long time, and they've also had struggles with excess hunger, like I talked about, where they never really recognized that feeling of full that everybody talked about. Or, not uncommonly, they're emotional eaters. They eat all the time. They're not very connected to their hunger signals. They crave food when they try to go on a nutrition plan and change their diet. They really struggle with a lot of food chatter. They can't stop thinking about food. That, I think, is the most significant thing that people notice, that they really are in love with. I just am not interested in food anymore. Food is not disgusting to them. It's not off-putting. They just don't think about it as much anymore. And that's really life-changing. I will say that, my success with people has been hampered by these very real shortages that we've run into. We didn't talk about that yet, but Wegovy was in pretty significant shortage, from really about June of last year, 2023, really until about now. And so it's been hard to get. And so a lot of my patients were taken off because they simply could not find the medication anywhere. Zepbound was just approved in December of 2023. The supply has thus far been good. The Wegovy supply is improving. So we're really kind of getting people back started on these medications. But The people who are responding early, especially because we started a low dose and we gradually work our way up, they're so relieved to not think about it anymore. I can share too, I've got a young woman who's been on tirzepatide or Mounjaro for close to a year now. She was able to lose successfully about 60 pounds.
Wow.
She was able to just get her hysterectomy. She, had a lot of bleeding. She didn't tolerate hormones very well. So she's just been bleeding and pretty significantly anemic for most of her adult life. And she was finally able to get the surgery that was going to fix it for her. And she's so happy.
Wow.
So a lot of really good heartwarming stories. And I expect we're just going to see more and more.
Yeah. Wow. I think it's an amazing time, isn't it?
It is.
I feel like obesity medicine is kind of going through what rheumatology has been enjoying for the last 2 decades,
Right.
which is just like a phenomenal breakthrough where there'd always been struggle.
Right.
And
we finally got more drugs that help people.
Yes, exactly. So much more fulfilling to feel, yes, we're actually getting results. We're helping people. People are having better quality of life. So yeah, welcome to the bright side.
Yes, I can tell you, I just love doing this work. I love sitting down with my patients, as I know you do, and, really talking through the challenges that they're facing and saying, I have solutions. Now,
isn't that something?
Not everybody is going to have insurance coverage. Not everybody is going to be able to afford to pay out of pocket. My menu options are not only these medications. So I have a lot of people being very successful with other choices. But I love having a lot of options to give people and being able to finally, be a part of the change in their lives, because how many people have been told, just, eat less, move more. You gotta lose weight.
Out.
You gotta lose weight. And no one was really helping them.
Yeah.
And we didn't get trained in how to help people lose weight. We've been trained in sort of the consequences of obesity, but not any of the science. So
not how to
I love being able to do this work.
Wow. Well, so Dr. Melo, thank you so much for the time. But before we let you go, can you tell us how can patients, because there are people that need your help, how can people find you and how can they work with you? And I know you have a number of options for people. So let's please share.
Yeah, so my clinic is Phinney Primary Care and Wellness in the Phinney Ridge neighborhood in Seattle, Washington. So up near the zoo and Green Lake. So come join us in that beautiful part of Seattle. You can find us at our website, which is www.phinney, which is PhinneyPCW.com. You can register there as a new patient if you're in the greater Seattle area, and then you can sign up for a weight management consult with me, and I'd love to meet you there and take care of you. I also have a YouTube channel where I share some information on weight management, so you can find that at Dr. Megan Melo, and you'll see some of my videos for people.
Great. So we're going to keep the links and everything kind of at the bottom of this video, and then when we air live. So Dr. Melo, thank you so much. So for everybody, if you like this video, please share it with anybody that you think will need it. Share it, like it, and also subscribe to our channel, Healthy Joints, Healthy Lives with Dr. Dada. Thank you, everybody. We'll see you next time.